Hello everyone. As of 8 a.m. Tuesday the 26th October, there have been 1,101 PCR tests since yesterday's report. Of these, there are 2 positive travellers who tested before their exit from quarantine, and they'll now obviously remain in isolation until they test negative. There are 90 positive tests from the community, which include 2 children. There were 2 admissions of people positive for SARS-CoV-2 in the last 24 hours, bringing the total admissions to 4. These 2 require supplemental oxygen still this morning, although they are stable. One has been there since early September, and the other was admitted for an unrelated matter. The vaccination clinics were not open yesterday. I know a lot of you will be feeling frightened or worried with this increase in numbers, but they really are, as we might anticipate, with this being such an infectious disease. In some ways, it's important to understand that once this degree of infectious disease is in the community, you can't really put the genie back in the bottle. It is with us as we move to reopen the borders further. In the meantime, I really need to ask you to follow the advice of people that you trust and have trusted for a good long while, and the information sources that are trusted out there too. So do please mask, distance, look after the elderly in the community and the vulnerable, and protect them as much as you can. Please also consider getting vaccinated if you're not yet vaccinated. Overwhelmingly around the world, the people who are admitted to hospital with serious illness and who unfortunately die, the huge majority of these are those that are unvaccinated, so we can see the evidence that it will protect you.
When I see people on social media saying that COVID is not real, it makes me so very angry. As a nurse, I'm like, how dare you just shadow me one day, just one day, just an hour. Walk around this unit and see what you see, and you will know that COVID is real.
I think sometimes it's easy for people that are sitting on the comfort of their own couch, posting on social media about why the vaccine isn't good for you. That's what I find truly frustrating, because we are in here and we're seeing it every day. We're watching people die.
I understand that people have certain reservations about the vaccines, but you see hospitals full of COVID patients. You don't see hospitals full of patients that are sick because of the vaccine.
We've been keeping track of our deaths that have been happening in our ICUs, and 100% of these deaths are in the unvaccinated individuals.
My father died in April. He was scheduled to get his vaccine the day he was admitted into the hospital, but they didn't have enough back in March. There are vaccines at every store, at every corner, and I'm taking care of people every day who make that choice to not be vaccinated. Don't let your families go through that pain. That pain is something that rips our hearts out every time we have to put your family member in a body bag, and then having to do it to our own family who would have done anything to be vaccinated but couldn't be.
I have been an ICU nurse for 16 years, and I have zipped up more body bags from March of last year to this point than I have in my career. When you are zipping up body bags for 2 30-year-olds within 48 hours of one another, you don't get over that.
Scientists all over the world are coming to recognize that this is a war that is going to be with us for a while, especially I think living in Florida with our current vaccination rates. This is a war that we're going to have to continue to fight, and our best defense against the virus is still vaccination.
Thank you for joining the CMR COVID Spotlight. I'm your host, Kevin Watler, and just wanted to bring on some experts tonight to share how the Cayman Islands medical system is prepared for COVID. We have a very, very excellent panel tonight that's made up with the Minister of Health and Wellness, the Honorable Sabrina Turner, Chief Medical Officer, Dr. John Lee, Health Services Authority Deputy Chief Executive Officer Ronnie Dunn, Health Services Authority Deputy Medical Director Dr. Courtney Cummings, and Hazard Management Cayman Islands Director Danielle Coleman. Really appreciate you all taking time out of your extremely busy schedules to join us for this very important discussion. So,
Thanks very much for having us.
Perfect.
Pleasure.
Wanted the Minister of Health to just have some opening remarks. Ms. Turner, would you like to at least share some opening remarks?
Sure, Kevin, and thank you. Good evening to all of those persons who are streaming and to the team here. And we're happy that you are able to put together a forum of this nature. And I'm happy to make sure that I carved out the time to show my support as Minister of Health and Wellness, not only to HSA, to the other government agencies such as HMCI, our own CMO, Dr. Lee, in showing that we're all of this together. We understand the apprehension, the nervousness, the anxiety that's being felt throughout our community, and having a forum such as yours that bring experts into one room to try and, keep the connection, keep the lines of communication open, try to dispel as much myths as possible, and trust these us as experts. Well, for me, being the elected person with that immediate responsibility as Minister of Health and Wellness, one can only understand the pressure that is now placed on our ministry. But it is not alone. We are definitely here as a government to provide all support and resources, and that has shown what we're willing to give to HSA and to our public health to assure the public that we are willing to work together collaboratively in making sure we address all of the issues and concerns. We know that there are persons out there who have expressed some concerns with the amount of calls and welfare checks. I'm quite sure throughout this show that Dr. Lee and some of the health services persons on this show this evening will also give some explanations. Now, whether or not we've gotten it right in the past couple of days, Kevin, we haven't, but who has? But what it has shown is that we have a dedicated team who are willing to come together to put the resources where we see that they're needing. Any little gaps, we're willing to put that, to fill them as quickly as we can. And I want to just thank the persons out there who have found themselves into isolation or quarantining for complying. And we're asking them to continue to give us the patience. We are doing everything that we can to make sure that we put the necessary resources and personnel within the respective places so that we can answer them and respond to them in a timely manner. And I thank everyone for their cooperation thus far.
And you said something very important because, I'm here in Florida, and certainly I happen to live in the county where the very first case in the state of Florida was announced. That was the one that was responsible to set up the press conference for the governor for the big announcement. And at that time, we knew absolutely nothing really, other than little bits of information that was coming out there that changed sometimes more than one time a day. But now we do know so much more about how to protect each other and also how to treat. And so wanted to make sure that we have that conversation. Exactly, obviously we have a lot of experts in the Cayman Islands. We got Dr. Lee, who's done a fantastic job. We got Danielle Coleman. We have a whole lot of people that I'm not even going to try to keep naming them because the list will go on forever, that is working so hard in the background to protect everyone. But again, as you said, not everything is done right. So how do we learn from some of those mistakes, and what do we need to sometimes take a look at? And so we want to make sure that we have this conversation. And I do want to go on to Dr. Lee. We did find out that we do have a couple of people, which is not unexpected, that are now on oxygen. What more can you share about that?
Nothing really further at a clinical level. I normally get a daily roundup in the morning. They were not requiring more than just supplemental oxygen. So we have not had anybody that's required breathing support since the 8th of September in terms of a ventilator or a breathing tube. So that's great news. But I think that is, as we've seen with the numbers climbing, we will end up with people who are seriously unwell, and we will probably end up with, unfortunately, some deaths. And as we heard in the video from Tampa, and as we have had examples from not only around our region, but from every single town and wherever there is a hospital, it's the people who are not vaccinated that end up the most seriously unwell and die almost invariably. And that's a, a huge wake-up call. It should be for everyone. And it's a stunning statistic.
Absolutely. Now, oxygen. We talked about oxygen, and I do know not just in where I'm at in Florida, but around the world, there was a medical oxygen shortage. What is HSA doing to make sure that they have adequate supply? So as the need likely will arise as there's more community spread, likely more hospitalizations, what is being done to ensure we have enough supply to be able to provide to patients should there be a need to have a whole lot of oxygen going out, and then there will be a shortage of what's available in what's typically there?
Thank you for that question, Kevin. We do have a reliable source of oxygen supply locally. In addition to the direct supply, we maintain adequate oxygen supplies on hand to carry us for at least 10 days under normal circumstances. Notwithstanding the fact that our supply has been reliable for all the years it has served us, we've also invested in the procurement of our own oxygen generating capacity, and we intend to install a plant here at the main hospital over the upcoming weeks. In the event that our demand heightens beyond what our local supply can provide, we have a backup source of supply. So we're fairly confident in our ability to manage the situation from an oxygen availability perspective.
Got it. Now, I guess if there's a contingency plan in place, let's say the machine decides not to work, because we know things break. And so what is the backup plan for that plan?
So the first line is the local supplier, which has reliably served us for many years. The second line is the oxygen stored in cylinders here on the compound, which can take us for a week and a half. And the third line then we will have is our own ability to generate oxygen from the plant we're procuring.
Perfect. And then have you been stocking up on things like monoclonal antibody treatment, which, we've seen a lot of success throughout the world? I know there's some here. I know America probably bought up most of this, so you don't have the ones where you can just inject inside your arm and your stomach. So you have to do it by IV because, countries with larger pockets are able to buy up the supplies. But what type of monoclonal antibody therapy treatments are you guys ordering, if you guys are ordering, and what's the supply like for treating patients with that?
So we have a range of therapy available to us, but I'm going to ask my deputy medical director to speak specifically in relation to the therapies available and the quantities on hand currently and those that are in procurement at the moment.
Okay. Yeah. Thank you and good night to everyone. Yes, we do have monoclonal antibodies on order. And the one that we have on order is the Regeneron, the one that everybody knows about. We've got 15 kits on order, and we are waiting arrival from overseas. Regeneron is really a big name, casirivimab plus indivimab. That's a combination. We do have that on order, and we should be having that on island very soon.
Appreciate you. And what about this goes into the financial part of it that some people might not recognize, and this goes into some of the discussions that I've had with some of my friends back home, unfortunately, that have chosen not to get vaccinated. They're talking about it's very expensive with getting the vaccine. My argument is I'm not sure if you really understand the cost of purchasing or getting treated for COVID, especially if you get monoclonal antibody treatment. It's not a very cheap thing. What can we say about the cost and the expense that is for the HSA to start stockpiling some of this type of treatment?
Right.
What I can comment on that, Kevin, is that we're blessed to have the full commitment and support of the central government in how we are managing the pandemic. We are given the latitude based on the clinical expertise to procure what we consider will be necessary by way of therapy for the effective management of persons presenting with COVID-19. And that money is reimbursed to us from the central government. So whilst it is the public purse and we continue to be prudent in how we manage that, we have not suffered from a lack of resources to be able to procure what we consider necessary to manage our local situation.
Got it. And I want to bring you in, Danielle, since we haven't had any questions. That's for you. I assume you guys at the Hazard Management Cayman Islands would be assisting with any type of surge that might occur. You want to kind of walk us through what some of the plans are should we fill our hospital and end up having to implement a surge plan?
Thank you, Kevin. And again, thank you to all your listeners this evening. Again, I think just looking back last year, obviously the National Emergency Operations Centre was activated for about 104 days. Now, obviously, the medical team is the lead agency in any pandemic. So we were all functioning on all cylinders this time last year for about 104 days. Whilst we're not activated right now as the National Emergency Operations Centre, Hazard Management and various other people from the actual NEAC do assist with that. So whatever the needs are, be it personnel, be it equipment, so forth, we can very much help with that. One of the things we've been helping with more recently, again, is the isolation humanitarian support. So whilst, of course, the flu hotline has been buzzing off the hook with clinical humanitarian needs and so forth, we've tried to take some of that burden off them in regards to the grocery shopping and those kind of humanitarian needs. So that's what we're there for. Again, I think it's very scalable right now. Again, Hazard Management is sort of operating with a few NEAC members like communications and resource support. But if by chance, this does get to a point that we really need more assistance, we can scale that up very, very quickly. And of course, everyone's sort of ready to go if it does happen, because that's the nature of what we do, be it a pandemic or be it any other emergency. It is very much scalable. So we just have to sort of take it as it comes. We're ready to go. The centre can be moving, even if it wasn't a pandemic, it was something else, we can set up very, very quickly and move within the space of an hour or two. So yeah, just there, surge capacity, helping any way we can.
Kevin, if I might just add something to that, because some of your listeners won't be aware, but the civil service has been been on a war footing for really some weeks now, meeting every day at 10 o'clock for at least an hour to discuss where we are, what we're doing, what's coming up, what's happened, what can we learn, and adjusting our response on a minute by minute level. And it is consuming all of the civil services energies to make sure they do as much as they need to do in order to keep the people as safe as they can and to be as prepared as we can for what may be on the way.
I think just to add to that again, Simo, I mean, it's so true. At the end of the day, that shared situational understanding and that everyone plays a part here, be it education, be it medical, be it disaster response. Everyone does have a role. So those program board meetings every day at 10 o'clock have been really helpful, making sure that everyone's pulling their weight and doing what they need to do for their specific subject. So they are really, really important.
We did have a question from one of the viewers, from Jane McCarthy. Where is the field hospital? So where would that, I guess, open up should we have to expand?
Ronnie, if you want to take this first, and I'll carry.
So the field hospital is part of our contingency plan after the existing capacity. Sorry, go ahead, Danielle. I'll let you take this one then.
No, I was passing to you first, but I guess at the end of the day, it's a joint project between health and hazard management and public works actually as well. There's going back to different stakeholders. To set up a field hospital is quite a big task, and it does take several weeks to do so. Obviously, health is the main lead, but there's a lot of logistics. I mean, last year we found some very interesting, creative ways. We mentioned the supply chain earlier on, Kevin, and supply chain, be it for oxygen or other things, in a global pandemic is is obviously sometimes quite difficult to get items. A lot of items last year, like toilet roll and other things like that, became an issue. So supply chain to a small island like ourselves, we do have to be quite creative, and we do have to make sure that we've got the kit. And if we don't have the kit, we can't get it. How do we improvise and make things? So I think there were some really good creative solutions last year. But I think I'll send back to you, Ronnie, just again, the current process where we're at with the emergency field hospital, to make sure that we are ready for any eventuality.
Thanks, Danny. Absolutely. We recognize the need for the field hospital as a contingency to the existing capacity that we have within our main healthcare facilities. We are discussing that in terms of the appropriate point to initiate setting that up. A number of the items that were procured last year when we set up the field hospital are currently in storage, and some of the facility that we did put in place in terms of backup generator and other electrical preparations still exists. The building we utilized last also is used to ministry to the community and to serve other purposes within the community as well. Fortunately for us, when we set it up last year, we didn't have a need to activate it. At the moment, we're working with those partners within the private sector and stakeholders to try to recommission the facility and have it available in the event that the core facilities reach capacity and there's a need for additional capacity. So we're hoping to be able to have that in place within the next, I would say, month and a half or so.
Kevin, if I may just add also that it's not just the HSA that we're able to rely on for resources. We are a country which has 3 hospitals and other resources beyond that. And all of these different agencies have all committed to 100% to supporting the initiatives to look after people should they become sick with COVID. So in fact, if you look at the intensive care unit beds compared to the 100,000 population, we have currently 37. And if we max out, if we use every bed just for COVID patients, we can actually reach 59 intensive care beds per 100,000 population. That's compared to the United States as 29 and the United Kingdom 6 per 100,000. We have at max 59. We never want to be using those. Please don't misunderstand what I'm saying. But we do have an awful lot of resource. If you look at the number of physicians that we have, the Cayman Islands has 321 compared to the United States as 277 and the United Kingdom's 230 per 100,000 population. And it's a similar story for nursing. So we are exceedingly well provided for on a per capita basis. But as we've said, we wish to make sure that we don't max things out. That's never a situation we want to be in. We want to slow the flow of people to the hospitals in order that we can continue to provide everyday services.
And the way we could slow that hospitalization rate is by...
Right. Can I quickly add if I'm... Okay.
Absolutely. Go ahead, doctor. And Dr. Cummings, when you talk, would you be able to just come a little bit more into the camera so we could see you, so you're not hiding in the corner? Dr. Cummings, are you able to hear us, or?
Right, I'm hearing you now. Right, thank you so much. Right, I think Dr. Lee touched on a very important point about the availability of resources. It's a combination with Health City and Doctors Hospital. We do work closely in tandem with this other group of physicians to pool resources and effort in terms of managing these patients. And yes, as patients come, resources will come from all of the hospitals to manage the patients. I just want to quickly add, in addition to all that was said, what would be the trigger to opening the field hospital? And one of the important things we should mention here, at HSA, we have 2 ICU beds that are airborne infectious disease type beds, meaning they allow the virus to be taken away from the environment into the air after being sterilized, so to speak, and it's safe for the staff, etc. We've got several other beds such as that. We've got one in the medical, one in the surgical, and the staff, Mr. Dunn and his staff, they've created a number of other negative pressure rooms at HSA. So we're in good shape in terms of about 13 such beds. But what we have said is once we've got 2 patients in critical care and we've utilized 2 in a medical ward, we're going to open the RCU. And once there are more patients, if there are probably another 2 in RCU, we're going to trigger opening the field hospital. I know the field hospital takes some time to get set up, but we have to have some way to say, no, we need to start doing this. Having said that, I know there's plans on the way to put things in place. So once we need to go, we'll be able to get on with it as quickly as possible.
Absolutely. And talking about, the negative airflow rooms, that sort of stuff as well too. I did have a question on that. Are there plans to have like a COVID wing or an area designated for only COVID patients in the Cayman Islands Hospital?
Yeah, so right now we have what Dr. Cummings referred to as the RCU, which is a respiratory care unit that has an 8-bed capacity. And the areas which are where we house our high dependency patients, such as critical care unit and others, do have the capacity for negative pressure environments, which we utilize to limit the potential for disease spread when COVID positive patients are within those areas. The dedicated wing for infectious disease is part of our facility plans going forward. At this point, the time it will take to get that building put up will not feature as part of the management of this pandemic, but we do recognize the circumstance that COVID-19 wasn't the first, it won't be the last. And so we have that as part of our plan going forward to create an infectious disease wing here at the Cayman Islands Hospital.
Now, in terms of your staffing at the HSA, what's that looking like? I know worldwide there's been a shortage in nursing staff. I know you said that, per capita when Dr. Lee gave us some data, but just because someone is also, have a credentials in nursing and be registered does not necessarily mean that they are practicing or available necessarily to be utilized. What are the plans to bring on staff quickly if necessary?
So currently within the Cayman Islands, and as my colleagues on the call have pointed out, that it is an entire health system approach. So we have 321 registered practicing physicians, 515 nurses across the Cayman Islands. At the HSA itself, we have 234 nurses and a little over 100 physicians available, in addition to 49 healthcare aides. So we have good capacity existing presently to manage relative to our population size, as Dr. Lee was giving those statistics in relation to other advanced countries. But notwithstanding, it's an active recruitment daily and weekly to bring on additional nurses as a contingency, and also to give our guys a break. It's been a very challenging year. We've had a number of people who haven't been able to take vacation all year, and burnout is real. So whilst we are comfortable, we are 1,055 persons strong as an organization, and close to 2/3 of that are in clinical areas. We have a plan in relation to, even after the currently practicing and registered nursing cadre is exhausted or reached this capacity, we do have a number of individuals and staff who were trained, experienced nurses who may have been promoted into administrative roles at this time that can also provide backfill support. So continuously recruiting, but feeling very good about where we are right now.
So I do have a question. Even though you might have a lot of staff, how many of them, or might not necessarily need a number, but what's being done to ensure that a lot of that staff is also getting familiarized with treating a respiratory type of illness?
So continuing professional education is part of what we do. We have infection prevention control coordinators, we have health and safety manager, and we have a clinical guidance document that's been put out by our clinical task force and rolled out to the various areas and clinical disciplines. So our staff since 2020 would be aware of the presence of COVID and that it eventually would get here and we would need to manage that situation when it does. And training through experience and through theoretical courses have been an ongoing process. So we feel very confident that our staff is trained, they're of a high caliber, and they are managing the situation, and we'll continue to be able to manage the situation going forward.
Can I just add to what Mr. Dunn has said?
Sure, Dr. Cummings.
Right, thank you. The clinical task force, which involves clinical personnel and others, physicians, nurses, pharmacists at the HSA, and that task force coordinates with other senior personnel, clinical people from other hospitals, Doctors Hospital and Hill City. The clinical task force, ever so often, we review the literature from the major, like, for example, Infectious Disease Society of America, CDC, on a weekly, maybe sometimes daily basis to see what is updated in terms of managing treatment, the types of strains we've seen of the virus, etc. And we do give, in fact, as recent as about 2 months ago, we had CMEs for the entire staff 2 or 3 months ago. So it's an ongoing, as Mr. Dunn said, exercise whereby we inform ourselves and our staff as to how we manage this pandemic.
There's a question from one of our viewers, Rachel. She's asking, are there a set of criteria for insisting further control measures to slow the impact of hospitals, such as curfews, work from home, remote school mandates, closure, indoor leisure, entertainment, gyms, etc.? And if so, what are they? And when do we need to take tougher measures to protect hospitals and health workers? I don't know if that's for the minister or who wants to take that one.
I might give it a start, and then if the minister wants to take it
you want to talk it for our community.
So the government has actually asked the civil service to produce a plan of readiness, which is a very active document and is being updated on a daily basis to not only document where we are and how ready we are now, where the gaps are that we need to attend to, but also in the same document to look at what the triggers are for escalating into, if we're moving into higher levels of community transmission, such that we'd need to instigate tougher measures to control transmission of COVID-19. Really, the most important indicator that we need to watch is the number of admissions to hospital, and whether the health services are coping with the levels of demand on the health services. And currently, as you're aware, the demand is very low, so we are not overly concerned. We have to look to examples of other countries where they have high vaccination rates rather than countries with low or patchy vaccination rates, because they're the best exemplars of where we are likely to be in a few weeks or months' time. And in those countries, you will have seen that although infection rates rise very high, the numbers of admissions to hospital are relatively constrained and people have been able to cope. Alongside that, the Cayman Islands instituted non-pharmaceutical interventions immediately there was community transmission. They did not hesitate for a moment, which means we're very grateful to the public for continuing to assist with distancing, mask wearing, hand hygiene, and also, very importantly, looking after the elderly and the clinically vulnerable in order to protect them, because they're most at risk of suffering. We are running out our booster program as we speak. We are getting close to 20% having had the booster, and we need to push that up as fast as we can, obviously. But there are a number of different measures that we've instituted. The high vaccination rates, as we've mentioned, the non-pharmaceutical interventions, and the booster program, which will all mitigate the extent of the demand on healthcare services. But in that same breath, we can never do enough for vaccination. The numbers of people who are coming forward sick are obviously worrying. And at the moment, they only have minor coughs and snuffles, but we don't want it to get worse than that. But there are an awful lot of young people in that group. A lot of dates of birth that I watch are people that are in their 20s and 30s. And that is also the group that are least vaccinated in this country. And I would really ask them to consider their decisions very carefully, because I don't want to see any of them in hospital suffering. And I really do not want to see anybody do badly as a result of COVID-19, because we know that vaccination can protect you from bad outcomes.
Yes, I must segue in on that. And we are noticing from the day of election, and we have resumed our positions, this government has been, pushing the vaccine and the uptake thereof. And like Dr. Lee just stated, we can see with those persons who have become sick, but low numbers of those persons not needing respiratory care. And we don't want to see that. But our plea will continue to be to encourage persons to get vaccinated. That will be the cry of this government, because we see, based on the data, based on the stats globally, not only locally, but globally, the positive effects that it will have on persons once the vaccine is taken. And we definitely will continue to encourage the uptake in that. And because stats don't lie, we just need to make sure that and we keep our fingers crossed and we have faith in God that, with the high number of vaccines that we have had on this island, that those numbers will actually continue to rise, and we will see the protection that is given our people.
And I really want to touch on some vaccine questions, especially to tackle and to really target message those who are vaccine hesitant. What is really being done to really reach that demographic? I've seen a lot of speeches, I've seen a lot of call outs, but I'm not hearing about a lot of going more or less directly to those who are unvaccinated and targeted missions to really try to encourage vaccines. So what maybe is that a hazard management function with, like, you guys got the CERT teams? Is there something more that can be done to have more one-on-one communication and access to really talk to those who are vaccine hesitant? Because a lot of them that I've spoken to are completely seeing and listening to a lot of disinformation, not a lies that is out there, but actually having that one-on-one communication. I'll stop there and see if Danielle wants to take that up.
I guess I'll start with it. I mean, I think it's really interesting here. Obviously in Cayman, we haven't had what the rest of the world has currently been experiencing for the last year and a half. We've been incredibly lucky. And I think it's often quite difficult to appreciate how lucky we've been until you start seeing the ICU beds becoming overwhelmed. So, we've been living this incredible bubble. And whilst we've had those, living regular lives, we haven't really been exposed to a lot of what other countries have been exposed to. And I think until that reality becomes the reality here in Cayman, we're still going to have vaccination hesitancy. I mean, we have one-on-one conversations with a number of people on a regular basis who are anti-vaxxers. Obviously, a personal choice is a personal choice. Everyone's body, you have that freedom of choice over here, of course. But at the same time, again, as the minister says, the stats don't lie. It's very, very clear that what we're seeing around the world, people who are not vaccinated are really suffering much more. And I think that, we can say it till with the blue in the face. I mean, you hear us on the press conferences, you hear us in, all our social media posts, anytime we're doing an interview, is, please consider, making informed decisions, speaking to your GP, speaking to people who you trust about the vaccination, and to keep that dialogue going. I think, unfortunately, it does get to a point, it becomes quite divisive. And at times, you can be as open and have these conversations as much as you possibly can, and willing to discuss it. But what I've also observing is that, some people are just shut off, and that they have a very fixed way about saying what they think. And I don't think there's always going to be a way of persuading those people otherwise. So it has to be a personal choice. But again, look at the stats, speak to people who you are informed and know what's happening around the rest of the world, and really, consider that decision, because it's only a matter of time until, again, we see the sad side effects here in Cayman that the rest of the world have probably seen much earlier than that.
Danny, just to segue onto that, I mean, look at some of the countries even in the region where persons are having a difficult time having or getting access to the vaccine. We cannot say that here in the Cayman Islands. From day one, we have had easy access, free of charge, that we have rolled out and given people the ability to get vaccinated. Recently, the government has even approved for duty free for even these lateral flow tests. We waived the duty on those, and we, the government, giving all of these lateral flow testings to the schools and making sure that we can get them out there. So it's not that we're not giving, making sure that you can't get access to anything in comparison to some other countries that don't have this luxury. We see the AstraZeneca is also now available for those persons who want the choice of AstraZeneca. But from day one, the Pfizer has always been accessible and free of charge here in the Cayman Islands. So there's so much a country can do and your government can do, but respectfully, we have to respect the rights of those persons who choose not to. But Dr. Lee, and the medical side of things, their consequences, I can understand those persons for religious reasons or for medical reasons, and getting deep, not going too deep into it, because we don't know, is it the chicken or the egg? That this is where the medical persons and data collection is key. But the bottom line and the big takeaway from this is that the Cayman Islands and the government has given everything very easy access to now the boosters, to having free access to the vaccines, and now the rollout of lateral flow. We've waived the duty, so even commercial persons can bring these lateral flow tests in free of no duty at all, and then your government is providing them free of charge. So we have done pretty much everything within our power to assist, and no one can't say that they can't get it, is what I'm saying.
Absolutely. Now, I do have a question as we talk about increasing vaccine numbers, but we're also entering, or we are now in flu season. And so I did have someone that did message me and want me to ask everyone on the panel tonight, why isn't the flu shot available at the same time you might want to come and get the booster? And then on that same question about boosters, it doesn't seem like there are very long lines, at least to get any type of vaccine. So why haven't teachers or the eligibility open up a little further by now if the vaccines are available?
As far as the flu vaccine is concerned, we follow the timetable of PAHO. That's where we get the majority of our vaccines from, and it's expected here in November. We don't have that much control over the arrival date of that. The vaccination, certainly when I went on Friday, had a big long queue, and I had a lot of reports of big long queues, which is off-putting for some people. We've opened it up quite quickly, firstly to over 70, then over 60s and over 50s in a very short space of time, 2 weeks, so that we can really allow the biggest access. We know that overwhelmingly the people that are going to do worst are in those age groups, the 50 and over. As time goes along, when we have good penetration in those age groups, we may well be allowed to extend it to younger age groups than that as well. Obviously, if you're clinically extremely vulnerable, you have access to it at any time, and also so do healthcare workers. We are following the, providing the vaccines under an agreement with the from the UK government, from the Foreign Commonwealth and Development Office, and so that does play a part in our decisions to an extent, although provided the Medicines, Healthcare and Regulatory Authority of the United Kingdom has approved something, we can vary locally should we wish. But we do want to make sure that all of those over 50 can have access to it, because the vaccines remain globally relatively limited. And we understand that we really do have to share the vaccines to other countries to make sure that at a global level, everyone gets vaccinated and access.
I think your question, Kevin, was whether or not public health for the vaccine clinics open or extend their hours.
well, extended hours, or at least, if we have the vaccine, also maybe have, if the health service authority and the medical teams aren't able to handle any greater demand, how about also letting private providers also provide assistance in vaccines, so you don't have just one or two locations available in a day, but also be able to go to a doctor's office or somewhere else to also be able to inoculate individuals.
HSA or Dr. Lee, because that would have been something that would have been agreed before our time. But I know the discussions did come up whether or not we would consider allowing private physicians to also give these vaccines. Would you either of you like to weigh in on that?
I mean, that's certainly a possibility. We've been discussing it. Under the current agreement with the United Kingdom, we would need to have a waiver because we've agreed that they would be given out by public health.
Okay.
And although we, as you quite rightly say, Kevin, sometimes there are no queues, sometimes there are queues. I think that most people, when they want to get access to the vaccine, they can get access, and we're running out. Not only do we provide district clinics as well, and often the nurses sit there doing nothing, but we also provide services to people's homes too. So if you're clinically very vulnerable and can't leave the home, we're providing services to there, and also, of course, in the institutional homes. So we are getting penetration to a number of different areas, and I suspect providing a very good level of service, and perhaps better than many other countries are able to offer.
Mm-hmm.
And this question, because this is actually just something that happened today, where the FDA just approved Pfizer for 5 to 11-year-olds. In your experience, I think this is more of a Dr. Lee question. How quickly does that typically happen, where you get approvals from the UK and on over? And I want to, before you answer, Dr. Lee, make everyone aware, if they're not aware, that the vaccines that would be available for 5 to 11-year-old, it is not the same dosage. It's actually a different Pfizer vaccine. Well, it's the same Pfizer vaccine, but it's a lower dosage, and the cap color is different. That's how you could tell the difference between the two. And so I know the Cayman Islands would not have that in their possession at this time. But in terms of how quick, when FDA in America might approve something, how long before the UK might decide, okay, we're going to go with this and also allow it for 5 to 11-year-olds?
I don't think it's really the case of just because the USA has done it, other countries would necessarily follow suit. The United Kingdom has often actually been the first person to do some of these things rather than the other way around. As far as the MHRA is concerned, they've actually often been relatively quick, provided that the manufacturer has approached them and asked them for the approval that is required. So it could well be that Pfizer have gone, and I think Moderna and Janssen, for example, have gone to the FDA and asked them specifically for their approval. But somebody would need to approach somebody like the MHRA or the EU and so on, all these different bodies for the approval. And the MHRA have been relatively quick. What's a bit slower is the government's, what they call the Joint Committee on Immunization and Vaccination, is to decide which groups to do. But once the MHRA have approved it, we could do it too. So that's what we would be looking for.
So let's take a look at some more of the viewer comments that are coming in. We've got one on the screen that says, can a person with a very high health condition get vaccinate high blood pressure, kidneys, lungs, and heart conditions? Question for Dr. Lee.
Absolutely. People with medical conditions are absolutely the category of people that we really want to get vaccinated. You are most at risk from getting sick from COVID. Therefore, we would like you to get the protection from the vaccination.
And we got from Denny Warren Jr. This is the ivermectin question. Are pharmacies free to dispense ivermectin for those who wish to use it?
I don't really. I think that ivermectin is a licensed drug, and therefore any healthcare practitioner is free to prescribe any licensed drug. Whether they are doing that, they need to make the decision that it's in the interest of their patient. But there's no particular limitation on any licensed drug that I know of, and not on ivermectin.
And then from Sean, we are seeing 80 to 90 new infections per day over the weekend period. would it be possible for Dr. Lee to provide some stats or data by the end of this week indicating whether these new infections are associated with the vaccinated or non-vaccinated young children who cannot be vaccinated be placed into a different category from those eligible adults?
If I take the second part first, young children who cannot be vaccinated are in a different category from those eligible adults. We have different plans for how to manage them in schools and in the community. One of the really big desires of this government is to keep education going, to keep the schools going. We know that in many ways the schools are one of the engines of our society, and if kids are not being educated and not growing up and being fulfilled, at the same time as also if the parents are needing to provide home care, then a lot of things stop. So we really want to keep the schools open in as safe and as healthy way as we can, which is why we are rolling out the lateral flow tests to schools with that aim in mind. The question has now disappeared from the screen, so I can't remember the rest of it. Apologies.
You went back to it. There you go.
As far as the stats are concerned, I would need to ask Public Health to provide these figures. I don't have all of them to hand, I'm afraid. They are not as easy to determine as you think they might be. When you get a test result coming back from the laboratory, it is not marked whether the person is vaccinated or not vaccinated, just as when your blood test comes back, let's say you had a full blood count or something, it's not marked whether you're vaccinated or not vaccinated. It actually needs somebody to do another check. So it's not as easy, and you can understand that when a lot of results come through, it becomes more and more tricky to do so. So I would need to ask Public Health for this, but it might not be as immediate as you would hope for.
Gotcha. And Nona was talking about, a lot of individuals who are 50 years and old. They stepped up to the plate. Thank you very much for doing your part to get vaccinated. And obviously, Nona's quite eager that the age group drops down to another number. We can go on to the next comment on Facebook and says, what's the plan for the ER? How are you separating possible COVID patients, COVID positive patients from the average person seeking emergency treatment? Are there pressurized isolation rooms in the ER? I know we touched on it, but you want to probably just summarize that again. I don't know, Dr. Cummings.
So thank you, Kevin. Within our emergency room, we have 17 care areas, including 2 isolation rooms. Sorry, I'm not sure if there's a delay, but within our accident and emergency area, we have 17 care areas, including 2 isolation rooms. However, what we advise is patients who are presenting with adverse respiratory conditions, flu-like symptoms, to go to our flu clinic as opposed to presenting our accident and emergency area. Accident and emergency, even under normal circumstances, sees anywhere than 25 persons daily. It's a throughput area. You present, and what we are experiencing, that people are presenting with other conditions, stomach concerns, for instance. But because our policy is that we test everyone before they're admitted to the hospital, we're then finding out that somebody's showing up for a stomach discomfort that needs to go on to admission, and tests before going on to admission are tested positive for COVID. So it's not, it does present some challenge when somebody comes and sits within your waiting area, because there's no immediate marking on the individual that identifies them as being COVID positive. What we're trying to do is to implement social distancing, ensure that our sanitization protocols are at the top, and advising patients who are symptomatic for flu-like symptoms to be managed in our flu clinic, which is more geared towards their management and not within the ER. There are some construction going on in the ER now with reduced capacity, so we're asking for the public's understanding over the next couple of days. We expect to have all care areas back in operation by the end of this week, and to only visit in the event of true emergencies to be managed in A&E.
Visitation policies, any changes to them with the increase of community spread?
Yes, so we are restricting the visitation policy. It's 1 visitor per patient per day. There are also age restrictions. Persons entering our facility undergo a temperature screening, except for those people coming in through accident and emergency. And we're trying to manage the numbers that are circulating within our facility as an infection prevention and control measure.
And we have some viewers in the from YouTube and from Facebook that are asking again about monoclonal antibody treatment. I know you said that they're on order. Do we have an estimated time when they will arrive, as well as, in addition to that type of treatment, what other treatment options are out there for those who test positive with COVID and end up in the hospital?
I'm going to let my colleague take that one. Go ahead.
All right, Dr. Cummings.
Right, thank you. So the monoclonal antibody is supposed to be arriving in about 2 to 3 weeks, I'm told, by my pharmacist, the chief pharmacist. They're on order and should be here in 2 to 3 weeks. With regards to the other treatment modalities, we have remdesivir, which is used in persons who have severe disease, moderate to severe disease. We have dexamethasone also. So those are the two main ones. But we've also have other medication. There's one called baricitinib, which is on order, and tocilizumab, which we have on island right now. So we do have a fair amount of treatment for patients who may present with severe disease or even critical disease, of which I mentioned dexamethasone, remdesivir, tocilizumab. Those are some of the drugs we have. And the others, complex names, I don't want to call them all, but they're on order also.
Got it. And we do have a comment from Andrew, who's saying, please share projections for the COVID wave we are in based on how Delta behaved in other countries. And I will tell you, we do have a show that we did with a data expert where you could actually see that. And we're going to be bringing him back on once we get more data. We've put in the request so we could have some more data so we could be able to do some new projections. So we'll have another show in the very near future on that. So if you want to go back to that show, if you go on Facebook, there is an actual show that is for a series for COVID Spotlight series that has every single show that we've done. I think we're at a dozen now. So please watch that as well. Do we have any insight into the current cases, such as transmission venues or age groups?
We certainly know that schools are a good place to transmit COVID. Actually, but we're seeing that in a number of different countries where, particularly as schools have gone back after the summer and in the Northern Hemisphere when it gets colder, children are a very good source of transmission of COVID, even though they don't necessarily suffer themselves. And that's exactly what we saw here in Cayman, that this infection appeared to start there and then spread into the adult population. Originally, it was almost entirely exclusively in children, and now it's moved into the younger adult population. But it does tend to stick in age groups because certain age groups tend to stick to each other. Obviously, you tend to socialize, 20-year-olds tend to socialize with 20-year-olds and so on. So that is what we're seeing, and it's not unsurprising.
Okay, and I'm going to take the last comment from our comments, and then we're going to go into closing comments. But did you have something to add, Dr. Cummings, before we?
Yes, if I could add,
sure.
That in the Cayman Islands, we tend to see a lot of the 20-year-olds and the 30-year-olds being the more, we tend to see more cases in that age group at this point in time. And the reason for that are, one, persons who are older may have been vaccinated. So there's a greater amount of vaccination in the 50-year-old and 60 because they were the ones at risk. The younger ones felt they weren't at risk and they were less vaccinated. First thing. The second point is, as Dr. Lee mentioned, there's more socializing. The younger ones, the 20-year-old and so on, they tend to, their lifestyle, going to the beach and hanging out together and so on. So I think it's a combination of things that has caused that age group to be the one that we see more infections in at this point in time on the Cayman Islands. Thank you.
And then for the minister, will we have a lockdown or some form of work from home order to slow the current transmission, or if we even go up even higher, maybe when would that potentially be considered?
Well, as the government, working in collaboration with other experts and modeling exercises, we don't plan at this very minute to have anything right now to say, oh, this is what we're doing right now because of the heightened numbers of positives that we've seen community transmitted for a lockdown. Now, in the coming days, in much order, we would be educating more, because we've drawn this thing of introduction of the high vaccination rate, the introduction of the lateral flow testing, and we're sensitizing our community with living with COVID. As Dr. Lee and HSA, the specialist, said, what would be the triggers to actually bring a lockdown hinges greatly on the amount of persons that we see showing up positive, the strain on our healthcare infrastructure, and definitely those persons requiring respiratory care or death. We have to, I think more and more, and we're going to be doing more education and more PR in this regard of sensitizing of what life is like being normal and living with COVID. And this is why you will hear us push and push and push for vaccinations, for persons who are eligible to get vaccinated, to go ahead and do it. The lateral flows are out there based on the guidance of public health and the experts. We are allowing those households who may have found themselves living in a home with a positive person who is not vaccinated, but if they're members within that household that is fully vaccinated, we introduce the lateral flow testing, and you do those tests once a day for 10 days so that you're able to go back out to work. This is the beginning steps of getting accustomed to living with COVID. Now, as the days go by and we constantly monitor what's happening within our community, and based on the guidance of Dr. Lee, public health experts, and other professionals, we will tweak that as we go along. But in the immediate form, we ask for organizations and employers to institute what they feel. We're leaving it up. The government isn't a government that wants to do anything to say mandate. We're all in this together, and we expect organizations and employers to adjust as well as helping us, the government, help us live with COVID and managing what life is like with COVID in our community.
And Minister Turner, I'm not sure if you saw, but I did a series. I spoke with Caymanians living abroad in a COVID-filled world show. I interviewed nearly a dozen Caymanians from all over America, Canada, in the UK, and explaining, hey, we could live with this thing. This is what we do. This is what I've done to protect myself, protect my family. And so if you haven't had a moment to watch that, these are, young and older Caymanians who are sharing their experience. I'm going to be reaching out to some more, and we're going to do some more to add to that. But yes, it's absolutely able to be done. I've been doing it. A lot of my other fellow Caymanians around the world have been doing it. We just got to make sure that we protect ourselves by getting fully vaccinated and just being safe, practicing safety things. I want to respect all of your time. I did say about an hour. We have a few more comments that came in. Would you be able to just go ahead and take them before we move into closing comments, or do you have to leave?
I'm open. What are the rest? Everybody else?
Yeah, happy to stay until they're finished.
Happy to stay.
I really appreciate you guys agreeing for that. So we got from Cayman Life TV, are there any concerns that people who might be exposed to COVID would avoid getting tested because they don't have symptoms and don't want to be isolated or quarantined?
Being exposed and confirming that they're actually positive, we're finding a lot of persons, that COVID is a communicable disease, and it's one that legally you have to report it to public health. So should people actually take that stance, they're actually committing an offense. And we're hoping and we're trusting the honorary system. And I'm quite sure you've heard Dr. Lee use that term before, that if people do these lateral flow tests and they see where they are positive or come in contact with a positive, that they would do the right thing. And I've seen a few persons who have come in contact with positive have done the responsible thing and sent out a message on their Instagram pages saying, I've been chest tested positive, and I'm letting everybody know who's been in my contact the first 24 hours, last 24 hours, to go and get tested. This is where we as a community is taking personal responsibility to help us manage this disease. So anyone who has that mindset and not doing the right thing is committing an offense.
And wanted to go back to one of the earlier comments that came up from Winston Hunter. Will there be a protocol in place for calls to 911 where infection is suspected? That would be a question for HSA.
What's the question?
Will there be a protocol in place for calls to 911 where infection is suspected?
Thank you, Kevin. We have worked on the protocols for our EMS response team to try to ensure that they're safe in responding to those types of calls. The prevailing view across our facility is one of guilty until proven innocent. So we have to treat every patient that we encounter as a positive patient until it is proved that they're not a positive patient. And our EMS team, being on the front line, responding to 911 calls, understand that more than potentially anybody else within the organization. So just this afternoon, I was having a conversation with our medical director. As conditions change, as circumstances evolve, we are reviewing all of our existing protocols, amending them as necessary, implementing stronger controls, because our healthcare system is a critical part of our national infrastructure, and we have to protect our frontline guys. So short answer, yes, we are having protocols in place to respond to 911 calls.
And just a follow-up question on that. I know we don't have a whole lot of ambulances to serve the island. And today we have a lot of respiratory calls because people are just, I tested positive and they just start to freak out. And it might be because they really need to go, or it might be that they're calling because they're very, very concerned. Whatever the reason is, it might tie up some ambulances. What's the plan to increase capacity in that regard?
So presently we have 5 ambulances. 3 are normally deployed at any given time, and we have 2 on reserve. That's on Grand Cayman. We have 2 in Cayman Brac and 1 in Little Cayman. It is not the ambulance crew's job, nor do they determine whether or not the reason why you call is serious enough for them to come. They are going to respond unless there's an ability to manage the circumstance based on the call to some other type of arrangement. And they work their hearts out. They respond. I know sometimes there's a queue based on the coverage areas that we have. We are procuring additional ambulances. Those will be here within a few months. Right now, the team we have and the ambulances we have are what we respond with. And they're coming for you if you call them.
Thank you for your answer. From Carol Adams, but repeated lockdowns just kick the can down the road and destroy mental health. That was, I guess, follow up to one of the earlier questions. We go down to Nikita. Living with COVID means you have to eat healthy and can't buy healthy food in Cayman. So that, I guess, might lead to a little different discussion on, staying healthy, cost of living, and other discussions on there. And I think that covered the questions that we had that came in. I really appreciate us going. Are you guys willing to go into overtime? And I'll move into closing comments. And Danielle, you've been the quietest, I guess.
Nice, very peaceful. I'm with an expert panel here. I'm very happy to hear what they have to say. It's really good. I guess just from closing, I mean, like any other situation, we every time hurricane season comes about, we always say be prepared for, by chance you get 3 to 5 days of a storm passing, you need to make sure you're ready. With this kind of community transmission, there is quite a big chance that one of these days you will get that call that you're either contact or that you do test positive. And we're really, really strongly encouraging the public to, make sure you are ready for that. Make sure you have the support plan in place with your family members who can help with that sort of supermarket shop or whatever else, your needs, your pharmaceuticals. Have a plan in place as a family. Because again, 2 weeks without any plan, staying at home is going to be very, very difficult for you. As I said, we have set up this isolation hotline to assist people who need it. Now, again, there is an assessment that people have to go through to get that assistance. So it's not, obviously free for all food, but it's very much the government is here to help you if you need those food supplies. And we're very happy to do that. So I will leave, Kevin, those numbers with you. But another thing, I thought that video you showed tonight was fantastic, the Tampa video, and I do strongly encourage people to, you to share that more, and we can share it with social media pages, because it's really important people see what the reality is out there that we haven't been exposed to so far. Thank you very much, Kevin.
Thank you, Danielle. And we've been actually sharing them on CMR. In fact, Tampa General, they've done a whole series that I think is number 5. They have different topics where they're going to their staff, sharing those videos, so you can see what's going on in their hospitals. Again, with my role here, I work with all of the hospitals in my region. But Tampa General's really taking a lead in making sure people are aware of the facts of what they're going through. And again, more than happy to give them to anyone there who wants to amplify them. We could absolutely use them to, again, get that message out there. So go on to closing comments from our HSA partners.
Thank you, Kevin. And in just closing, I would just like to express sincere gratitude to our team. 1 out of every 70 people living in the Cayman Islands work at the HSA. We're going through this journey as a community. We are your neighbors, your brothers, your sisters. And as many people have expressed previously on calls, there isn't a script that you're going through. I know sometimes the public try to access services and it might not be as efficient as one would like. But I'd just like to assure the public that the men and women working here are doing their very best. We are trying to deliver services to the standards that you deserve, and we will continue to do so. We don't know what the next month or 2 will bring, but you can be assured that the HSA is going to be working very hard to manage the circumstances that present as we go through this pandemic. And thank you for having us on the show.
Dr. Cummings?
Thank you, Kevin. I just want to endorse what Mr. Ronnie just said. And I would say to the public that, and the public has done well, I would say to the public, if you remember last year, we had no treatment at all. Now we have the vaccine. And not only that, we've got treatment in terms of drugs, remdesivir and tocilizumab. So I'm saying that things are going to get better with regards to managing this pandemic. So hope is there. It's going to get better. And I say to people, continue to protect yourselves, wear your mask, do the best for yourselves, and we will get through this. Thank you very much.
Dr. Lee.
Thanks, Kevin, and thanks very much for the opportunity to speak. It's really great to reach different audiences, so it's always very welcome. I absolutely echo what other people have said, and the future is looking a lot better. We are in such a different place, and I know it's a worrying time here in Cayman. You can reduce that worry by getting vaccinated because it'll protect you, it really will. But it will get better. There are a lot of very good drugs out there, tablets that are going to work against COVID should you get it, and so on and so forth. So I thank everybody for their attention, and really keep going with the non-pharmaceutical interventions, distancing, masks, hand hygiene, because they will protect you to a good degree.
Thank you, Dr. Lee. And did have another question that came in right before, and this was going to be for you, Minister Turner, and so you could embed it into your closing comments. But the question is, how is the Cayman Islands government mitigating for and preparing to deal with what appears to be the potential uncontrollable community spread, given the statement made on social media and other platforms by people who are experiencing symptoms but refusing to get tested for fear of being put into isolation?
Okay, that is one of the things that actually hampers, and it's a personal decision, in all honesty, that people have to make. We have made public and we have appealed to persons to get vaccinated. You choose not to, and you think you may have come in contact with somebody who's positive, and you're home feeling sick, but you refuse to either call the flu hotline, which is a perfect way to segue into that. That toll-free number is 1-800-534-8600. Should you have these symptoms, or if you get to a point where you're having difficulty breathing, you call 911. Now, why should one have to take that gamble in your life? The government is not or we don't want to. Our whole narrative and our approach at this juncture, understanding that we are in a high community spread at this time, we don't want to be that government where we have to mandate everything. We aim to make sure that we got our vaccination rates up to 80%. People were saying it was impossible. We are almost there. And we are seeing the positive effects that is given. We can only continue in that drive to encourage persons to get vaccinated. We have seen the mental hardships that isolation and lockdown has actually played. We've seen the damages that just trying to maintain a state of this bubble, which unfortunately has been pierced. And as Dr. Lee said today, the genie's out of the bottle. Can't put it back in. What it has done to businesses and people's lives. We have to come to that place where we are sensitizing, educating our people, but making sure our most vulnerable is protected. And the only way we can do that is to make sure that our people get vaccinated and continue in that vein. We are not here to hold a stick over people's head and go into that deep legislation. And I'm hoping that in a few days, when we roll out exactly what are the triggers and working alongside programs board so that we can have a more dialogue with industry stakeholders, which we've already started doing that people will understand and trust us. Trust your medical provider, trust your public health. And I must take this opportunity to honestly state that as your elected officials, we have gotten a number of calls. We are getting beaten up that the flu hotline is not working. We have put in the isolation support hotline that Miss Danny is heading up. And that number for persons who need groceries or just assistance with getting those letters for your employers. And please correct me, Danny, if I'm going off, but that welfare support line for groceries and non-clinical stuff is 1-800-534 3530 or 946-3530, and it's running at the bottom of the screen. These are all of the things that we're trying to do in order to make life as easy as possible while assisting you to adhere to the isolation and quarantining protocols. And that's all we can do really at this point in time. We have listened to the people. We hear your concerns. We understand your frustrations. Right now, with what's going on in our sister islands, that they're seeing some community spreads over there. Over in the BRAC, that has our most aged population. That's our history. So we are doing everything in our power to make sure that we put all the necessary resources and personnel in place. But we, as an elected government, public health staff, HSA staff, Danny and her crew, we can only do so much and no more. Community participation and cooperation is key, and we have to do this together. So in the coming days, I want to thank you for allowing us to have this forum. And you can see we are dedicated to making sure, and this government at the forefront is making sure our people will always be at the forefront. And we are making sure that all protocols are in place to keep persons as safe as possible. And I hope that that is reflected in the cautious approach we have taken with the reopening of our borders. And it's not that we're not aware of the high numbers of community positives that are out there. We are listening, and we're definitely trusting the guidance of the experts that are behind us, hence the panel that you have on your show tonight.
Really appreciate you, Minister Turner, Dr. Lee, Danielle Coleman, also our partners from the HSA, Dr. Cummings, and as well as Ronnie Dunn. You guys have been amazing to give us all of this information that you all did. We had quite a bit of people that were watching, and of course, we always have a lot more that end up watching after the fact because they're unable to do so because sometimes the time doesn't work with their schedules. But again, thank you all for taking the time to come on tonight. We'll certainly have more discussions as we go along, and we'll go from there. I do encourage everyone to watch the previous shows that we've done. We'll be starting to air them on Cayman Mall Road in the future as well. So on Fridays, I believe we'll start to air a lot of them. If you we're not able to watch them, but again, they still live on Facebook and YouTube at all times. Coming up next week on Thursday, October 28th, we're going to be looking into what does the data tell us about COVID. I know we've had some of those discussions before, but Dr. Jason Salami from the University of South Florida, he's a data scientist. We'll kind of look at some of what the data is telling us, and we're gonna have some discussions with him as well. And the shows that we previously did, role of an epidemiologist and contact tracer, frontline healthcare workers, they highlighted their experiences, COVID-19 vaccines, cons, pros, and we also talked to those who are actually involved in clinical research. We had a discussion about COVID-19 and children from a pediatrician who's also an infectious disease doctor. The history and effectiveness of COVID-19 vaccines is another show that we did. We had different doctors sharing their opinions on addressing and managing COVID-19. We had them came on. We also had Predicting Cayman's Future Outbreak Impact. That's the show where we did some predictions of what it could be expected in the Cayman Islands, and we're waiting for some more data to do some more accurate predictions. We also did a show dedicated for those who might have heart issues like myself. The heart in COVID-19, the importance of getting vaccinated if you have any type of cardiac issues. And again, we checked in on the last show with private providers, how they're preparing. And on tonight's show, we found out how HSA is preparing and how they're preparing the Cayman Islands medical system. So we've done a lot of shows. We're still going to keep on doing these shows on other topics that are coming up. So look out for the new topics once they come out every Tuesday and Thursday night at 7 o'clock. We're going to be doing more and more of these things. Again, tune in tomorrow morning on Sandra's show. We're going to be having a lot of exciting topics coming on there. And for right now, I'm going to say good night, everyone in the Cayman Islands. Thank you for watching the CMR COVID Spotlight.
Good night.
Ho, ho, ho! It's that time of year again. Christmas is right around the corner, and you do not want to delay. Because of COVID-19, there are numerous logistics delays expected. Give yourself the gift of a true Christmas miracle by planning ahead with Miracle Brokers. Whether you're moving halfway around the world or ordering a new car for your loved one, contact Miracle today at 949-5989.
Beginning the 10th of October, residents across the Cayman Islands will be invited to participate in the 2021 census. What is the census? Simply put, the census is a head count of every person living in the Cayman Islands. The population count and data are protected and authorized by the Statistics Act. The information is confidential and cannot be shared with any law enforcement agencies. Your response helps guide business, social, and economic planning for the future of our islands. The 2021 census will inform decisions on how millions of dollars are allocated for roads, schools, hospitals and healthcare clinics, fire, emergency response services, and other programs. Census enumerators will visit your household, ask a few questions like how many people live in your house, including their age and sex. Every person counts, no matter who you are or where you live. So have your say in the 2021 census.
When I see people on social media saying that COVID is not real, it makes me so very angry. As a nurse, I'm like, how dare you just shadow me one day, just an hour. Walk around this unit and see what you see, and you will know that COVID is real.
I think sometimes it's easy for people that are sitting on the comfort of their own couch posting on social media about why the vaccine isn't good for you. That's what I find truly frustrating, because we are in here and we're seeing it every day. We're watching people die.
I understand that people have certain reservations about the vaccines, but you see hospitals full of COVID patients. You don't see hospitals full of patients that are sick because of the vaccine.
We've been keeping track of our deaths that have been happening in our ICUs and 100% of these deaths are in the unvaccinated individuals.
My father died in April. He was scheduled to get his vaccine the day he was admitted into the hospital, but they didn't have enough back in March. There are vaccines at every store, at every corner, and I'm taking care of people every day who make that choice to not be vaccinated. Don't let your families go through that pain. That pain is something that rips our hearts out every time we have to put your family member in a body bag and then having to do it to our own family who would have done anything to be vaccinated but couldn't be.
I have been an ICU nurse for 16 years, and I have zipped up more body bags from March of last year to this point than I have in my career. When you are zipping up body bags for two 30-year-olds within 48 hours of one another, you don't get over that.
Scientists all over the world are coming to recognize that this is a war that is going to be with us for a while, especially I think living in Florida with our current vaccination rates. This is a war that we're going to have to continue to fight, and our best defense against the virus is still vaccination.